Okay, we're recording. Great. So, Mr. Chang, you just had a really engaging session on AI in healthcare, and I think one of the strongest points that you made is that it's soon going to be unethical to not use AI in healthcare. Can you maybe expand on that a little bit?
Well, of course, that statement has to be interpreted correctly. I just mean in certain situations in which there are cases that have used AI for quite some time and proven to be effective, that we are reaching a point in which the standard of care mandates that you use AI in a timely fashion to make the correct diagnosis.
Mm-hmm. Radiology is probably the prime example.
The one that I'm seeing some activity in terms of people holding the hospital accountable would be radiology, particularly brain scans and probably cardiac scans as well.
Mm-hmm. Another thing that you also mentioned is that sometimes you consult hospitals around their AI approach, and it's not that rare that if you ask, can you show me your AI strategy, that the strategy actually isn't there. So what's your advice to hospital leaders in terms of how to approach that? What if they already have a data strategy and a data governance strategy? What's the key thing that's usually missing? And what's your advice on where to even begin?
Yeah, my comment was that oftentimes when we get asked to talk to a hospital about their AI strategy, they don't even have a data strategy or data governance yet. So I think you start with a foundation, which is the data governance, and then you build on top of that an AI strategy or governance and also a committee. So it's something I said during the talk, which is AI agenda in healthcare has to be driven by human-to-human interactions and relationships.
Mm-hmm. And also that change is not technology-driven, it's human-driven. I thought
exactly
that was
right.
one of the better ones as well. So
I think it's one of the beautiful things about AI in healthcare is the technology is pretty robust and mature right now, but it does take humans to learn about it, to adopt it, and to use it effectively.
Mm-hmm. Where do you see the biggest danger of AI at the moment? One of the participants mentioned the fear of, the data sets that are not diverse enough, which doesn't seem that is going to improve in the future. So her call to action was for people to gather as much data as possible. So how do you see that development and basically the biggest challenges that AI is going to face before it's more broadly distributed?
Well, I think AI is going to hold us accountable to make sure that the data sets are balanced and there are technological workarounds that we can do, like use of synthetic data that's effective. I'm actually much more concerned about the mature AI tools not being used efficiently and effectively to help mitigate the burden that the caretakers have, as well as the disease burden that we have in general.
Where do you see the reasons why the tools are not used effectively? And which reminds me that you mentioned that basically out of the 4.2 trillion US dollars that's used in healthcare, basically 25% could be reduced with the use of AI in administrative tasks. So why is this not happening?
Well, I think the one reason is that not enough people are educated in this area, which we're trying to solve here partly, and the other reason is, and there are many reasons, but one of the other reasons is that the financial incentives are not aligned between the payers and the providers and the hospitals and the patients. So it's, having an AI as an elegant solution can't solve the human-driven problems, which is alignment of the financial incentives.
Mm-hmm. Is there anything that you think that people should currently know about Agentic AI, which was discussed at the end of the workshop? And you mentioned that it's often confused with AI agents.
Yeah, it's an easy thing to misunderstand or be confused about. I look at Agentic AI as a very capable captain of a team on the field. There's quite a bit of autonomy with the coach's direction, by the way, which is the generative AI part. So the Agentic AI would be the leader on the field with autonomy, and the individual players could be, we could draw the analogy that they're the AI agents, that they do things autonomously, but with the overall autonomy of the agentic system.
Mm-hmm. Well, thank you so much
welcome.
for the insights, and enjoy the rest of the conference.
Thank you.
Okay.
Thank you.